President Cyril Ramaphosa will lead the Presidential Imbizo in Emalahleni. That's in Mpumalanga this morning. Ramaphosa will interact with community members from the Nkangala District Municipality. The theme is Leave No One Behind, and the government is hoping this interaction will promote participatory democracy and inclusive development. Now, Samkele Maseko is part of our team in Mpumalanga for us, and she's watching developments and joins us now live. Samkele, all the irony of the president being there when there's a water outage. Help us place, perhaps, beside that, why strategically it's important for him to show face there.
Well, and we do know that the area of Middleburg, the area of Nkangala, and the area of this specific municipality, Emalahleni, and the Middleburg municipality have been struggling with water issues. The president is part of this Presidential Imbizo, which looks into the daily lives of the people, addressing some of their societal needs that may not thoroughly filter through to national government. This is the second Presidential Imbizo that the president is having in Mpumalanga. The first one, he also held it here in this specific province. Just behind me, the president is coming to inspect this particular hospital that is being built and is yet to be handed over to the Department of Health and to the government within the province. I am going to bring in Mr. Sekane Manzini, the MEC of Health within the province. Mr. Manzini, just the essence of this particular hospital, when was it conceptualized and how much has it cost thus far to erect this particular hospital, and which community is mainly going to benefit from this specific hospital?
Thank you very much to you, Samkele, and viewers at home. Indeed, this district hospital is Middleburg, and we do have a hospital Middleburg, but it's an old hospital, hence the decision to build a new hospital. And we are here today. I might not have the necessary amount so far that has been spent, but I can say that the hospital is almost complete. We are just waiting for a few equipment that must be installed. We've started putting furniture inside, and very soon we'll be opening it officially, the hospital, before the end of April. And we are happy that finally the people of Middleburg will have the dignity in terms of the infrastructure, because you know that as government we do provide quality healthcare services, but the only thing is that in terms of infrastructure, and the reason why is because since 1994 you had to compete in terms of building new infrastructure and maintenance. So because of that, but in the province we can say that we did identify a hospital that needed to be built, and we have completed most of them, and we are going to continue to do that. But we are happy that finally we are here, because it has taken long for us to, you remember also COVID did not assist, because we're supposed to complete it during the time of COVID, but with all these delays and some equipment are not even from the country, we have to wait, so those disruption. But finally we are happy that we are here.
How many hospitals are being built across the province since your tenure you took over as the MEC of Health, looking at how government has been struggling with the infrastructure rollout, and that's one of the anchors of economic recovery within the country, to anchor South Africa's economic recovery around infrastructure development?
In the province, we can say that we are building Mpumalanga Hospital, which is a regional hospital. Betal Hospital is completed, which is in Kharsibande. Mpumalanga is in Nhlanzeni, and also this one, which is in Nkangala, now is completed. So there are also major maintenance of a big hospital like your Mamitlake, that is also almost complete. So, and also you must remember that we are preparing for the NHI. So our focus also is on primary health care, meaning that access to quality health care services. That means you must have clinics. So there are quite a number of clinics that we've been building in the province, and also as a province we have got a pilot project around Kharsibande, where National assisted us in terms of building clinics. So we can say that in terms of access of healthcare services in the province, there's a lot that we've done as a provincial government, and we'll continue to make sure that our people get this quality healthcare service with dignity. Also, like I've said, quality healthcare services, there is only that. I always tell people, when you go to a hospital, you'll get the same service that you'll get from private, but the only difference is that the five-star hotel, you can't get it. But in terms of quality healthcare services inside, specialists, doctors and everything, you will get in medicine.
On the issues pertaining to locals within Middleburg, the Steve Tshwete local municipality, Chris Tembehile Hani municipality, Nkangala, Emalahleni, they've been struggling with water in these areas. What are some of the initiatives that, as the provincial government, when you sit at Exco, that you discuss in specifically looking at areas of water, knowing that the Premier comes from this specific area, the MEC of Human Settlements and the Deputy Chair of the governing party, Speedy Mashilo, also comes from this particular district?
Yes, you know that there is a DDM model that we have implemented as government. So our premier has appointed champions in all the three districts, mainly to look at that. And over and above that, there are meetings that the premier coordinates together with all the mayors and the MM, so that we discuss issues of basic services. We can say that coordinating structure that the premier is doing is assisting a lot, because when there are challenges of water, of basic service, there are some interventions that are there. Like also when we are building our own infrastructure, we assist in terms of bulk, like with this Middleburg Hospital. When the municipality could not afford the bulk, to put a bulk here as a provincial government, we were able to assist. By so doing, it's not only this hospital that is going to benefit, but also surrounding areas. So we work very well with our local municipality through the premier coordinating everyone.
Can you just whisper to the SABC viewers, which number are you on the province to province list?
I'm the Minister of Health in the province. I don't speak about those things.
Which number are you on the province to province list?
I don't know.
Are you going to province or to national? Are you on the province to province or province to national or national to national?
The ANC will tell me where to go.
You don't know where you're going?
I don't know.
Thank you very much, Sase Kanewans. That's Sase Kanewans in the Ministry of Health, basically saying that the community is going to benefit from this specific district hospital that is being built here. Bulk infrastructure has been put in to also assist with areas of water. And you'd know that the Nkangala District and its local municipalities have been struggling with ailing infrastructure, particularly when it comes to water provision. I just saw during the course of the week there was one of the protests in Woodbank surrounding issues of water, which is some of the areas that the Minister of Water and Sanitation, Senzo Mkhunu, along with his deputy David Mashobo, who also comes from this specific province, has to look into how they try and resolve the water reticulation issues within this Nkangala District Municipality and its local municipalities.